Hot medical topic right now, Jamie. Those extra pounds on the waistline, don't look at me, are more than a vanity concern. They can also be a sign of a very serious health risk. Dr. David Samadi is a member of our Fox News Medical A team and the vice chair of urology at New York's Mount Sinai Hospital. Doc, let's get right to it. This is a very serious issue. It
is. And also what we want to people know is look at the waistline. And it's very easy to measure this. You look at your height in inches divided by 2, and that should be the waistline. For women, it should be less than 35. For men, it should be less than 40. I use body mass index in my practice, and that's actually quite helpful. And there are some measures.
Okay. Well, you talk about waistline. Jamie, you fit the bill. I've got some work to do, obviously. So
no,
this is a
Kelly,
very important
this
topic
segment
for all
really
of us.
isn't for you or me. We want to keep folks
everyone.
healthy, and a lot is stored at the waistline. Doc, what difference can it make if you actually can trim your waist, and how do you do it?
Okay, that's a very good question. So what we have over here is the actual belly fat. What we're talking about is not the subcutaneous fat, which is a patient that looks like a pearl shape. We're talking the apple shaped type of patients. We're talking about visceral fat. This is the fat deep inside the abdomen. Jamie, what it does, it's actually working like an organ. It works like a thyroid or pancreas. It actually can secrete hormones that can cause inflammation on the vessels and on the heart, known as cardiovascular disease. What's interesting is on the liver, it actually sits by the gate, and it can actually increase the fatty acid. It increases the bad cholesterol, lowers the good cholesterol, and your triglyceride and cholesterol can go up. The effect of it on the muscle is devastating. By reducing the amount of insulin and the fact that it won't work, the sugar will go up, and the patients can end up with diabetes mellitus. Finally, the effect of it on kidney, by squeezing it, you absorb the sodium. The blood pressure can go up. And guess what? High blood pressure, diabetes, high cholesterol, all of that is known as metabolic syndrome, which is a big term, Kelly, that doctors use, ultimately ends to stroke and heart disease. And this is really a big problem. And everything starts from right here.